start with briefly introducing ourselves as the presenters. So Evan, would you like to go first?
Sure, thank you. So my name is Evan Vipond. I'm a Ph.D. student at at York University in Toronto, and right now I am looking at starting the dissertation process, which is going to be looking specifically at trans research and trans health and policy. So this very much connects to the work I'm doing. And I'll turn it back to you, Corey.
So my name is Corey Flanders, and I'm an assistant professor in the Psychology and Education Department at Mount Holyoke College. I'm also on the leadership committee for the LGBT Special Interest Group with the Society for Community Research and Action, the hosting group and organization for this particular webinar. So I'm going to first take us through the schedule for today so you all know what to expect this evening. But we're going to start with outlining recent research on trans health, particularly research around trans youth as well. And then we'll discuss a little bit of the history of research with trans people and communities, and through that talk about the importance of integrating community-based research principles into this type of research. So we'll sort of concretize this with an example of a community-based research project on trans inclusivity within sexual health education that Evan and I have both worked on this past year in Toronto. And within that, we'll talk about what went well, what we could work on and stand to do better, so talk about lessons learned throughout that project. And then hopefully we'll have the last 10 to 15 minutes today for a question and answer period. So next, Evan is going to take us through some of the language that we'll be using throughout this webinar.
Great, thank you. So it's always important to define terms, especially when you're talking about people's identity and different ways of classifying and categorizing people. So it's always really important to make sure your language is respectful and that you know what the different terms are. So the main term, of course, is transgender, which we often refer to simply as trans as well. Sometimes that's with an asterisk. And the term trans and transgender are really umbrella terms for anyone who doesn't identify with the gender or sex that they were assigned at birth. So this might include trans men, trans women, those who identify as transsexuals, those who identify as neither a man nor a woman, or perhaps both. Another term under that umbrella is non-binary, which we'll be discussing today as well. So the term non-binary is also an umbrella term, and that's for anyone who identifies outside of the binary of man or woman. Another term that's really important to know is cisgender, also sometimes shortened to cis. So cisgender is a term for people who identify with the gender and sex that they were assigned at birth. So cisgender is a term for non-trans people. And finally, we should define youth and what we mean when we say we're focusing on trans and non-binary youth. So because this project was through Planned Parenthood Toronto, their services include youth between the ages of 16 to 29. So that was really the age group that we were targeting, our trans and non-binary youth from 16 to 29.
Great. Thanks, Evan. So I'm going to start talking a little bit about health research currently existing with trans youth, and then Evan will go into a little bit more detail on that. So there's not a lot of data out there currently on the health experiences of trans people overall and of trans youth in particular. Largely that's because gender identity doesn't get included in large-scale population health studies. So, for instance, gender identity isn't included on the census in the United States. But the research that is out there does indicate that trans youth experience higher levels of vulnerability for negative health outcomes. So there's a couple listed here. One was a population-based study conducted in New Zealand with adolescent trans people. And the researchers here found that in contrast to their cisgender peers, that trans youth were about 6 times more likely to report depressive symptoms, about 5 times more likely to attempt suicide, and 4.5 times more likely to be bullied in school. Another study conducted in the United States with a cohort of trans-identified youth found that these youth were 2 to 3 times more likely to report depression, anxiety, suicide ideation attempt, as well as non-lethal self-injury. So we are seeing elevated vulnerabilities for negative mental health outcomes. And Evan will continue telling us a little bit about this research.
Great, thank you. So when there was a US-based study in 2011 that had some key findings on some of the discrimination that trans people face when trying to access proper health care. So, first of all, 28% of respondents said that they had postponed medical care due to transphobia that they'd experienced. So, medical care in this case includes anything from visiting the doctor to going to the emergency room to specialists, any medical service really. Another 28% said that they had experienced harassment or violence in a medical setting. So again, this is contributing to why trans people may not feel safe in medical offices and when seeking health care. Another 19% were outright refused medical care or treatment, including sometimes in the ER as well. So once they had either disclosed or been found out that they were trans, they were refused that care. And 50% reported that they had to teach their medical providers what they needed in terms of their health care. So 50% said that the doctors lacked that knowledge about what it means to be trans and what that could mean in terms of getting adequate health care. So these are really significant numbers. An Ontario-based study called Trans Pulse has done extensive research throughout Ontario here in Canada to look at the discrimination and inaccessibility of healthcare for trans people. So 40% reported that they experienced discrimination from their family doctor, and 41% avoided the emergency room altogether, again, due to transphobia. So we can see how having not feeling safe in a medical environment can actually postpone healthcare, and by postponing it, this can often exacerbate the issues. So we can start to see why trans people may suffer from health conditions that other people may have already gone to the doctor to get checked out, for instance, because there's just that fear and that experience of rejection, but also of not having adequate care, even if they do accept you as a patient. And TransPulse also found that when transphobia decreases, access to medical care increases. And that, again, with access to medical care, rates of depression and suicidal thoughts also decline. So there's a direct correlation here between standards of care and service and the mental well-being of trans patients. So multiple studies have shown that the psychological, social, and biological factors combine to create greater sexual health vulnerabilities among trans people. And this might include higher rates of HIV, for instance. Again, it's important to consider the various factors that may exacerbate these conditions. So health inequalities, as we've discussed, are driven often by stigma and transphobia. So this can increase stress in the patient and also may prevent seeking out adequate care. So it's important to research in a sort of more appropriate and compassionate way with the trans community so that we can properly address these health inequalities. And there's a long history, for instance, of pathologizing trans people. And trans people have been subject to study after study by medical doctors, psychiatrists, psychologists, and one of the biggest barriers is this constant pathologization. So often trans persons who might be experiencing other mental health concerns that may be suddenly attributed to their being trans, or their transness suddenly becomes a symptom of another mental illness when these aren't necessarily related at all. Or for instance, as discussed, transphobia can be a significant contributor to depression and anxiety. So that's why it's really important that we keep in mind this history and that we provide the opportunity for trans people to speak for themselves and of their experiences.
Okay, thanks, Evan. So as Evan was discussing, because trans people and trans experiences have been pathologized and often continue to be pathologized in current research, and also because youth are oftentimes disempowered when it comes to health research, in particular sexual health research. One way that we can try to fight against these inequities and pathologization is through implementing community-engaged or community-based research principles. So some positives of taking these types of research approaches are that the research goals are oftentimes determined by what are community priorities as opposed to what is a priority of an individual researcher. And community members are seen as active knowledge producers as opposed to passive research subjects. So there's a much higher involvement of community members in the direction, production, and dissemination of community-based research. There's also explicit attention paid to the experiences of marginalization and power imbalances between researchers that are based out of institutions and communities that we engage with and work with. And I think this is particularly important when thinking about working with youth, since there's oftentimes already an imbalance between adults that are researchers and the youth communities that they're working with. So I'm going to start talking a little bit about the project that Evan and I worked on over this past year. And so it was called Creating Trans-Inclusive Sexual Health Education Guidelines. So this particular project was led by Planned Parenthood Toronto, in particular Cheryl Dobinson, who is the Director of Research and Community Programming at Planned Parenthood. And so this research was conducted in partnership with a youth advisory committee that we'll talk about in more detail later, comprised of trans and non-binary youth between the ages of 16 and 29. There was also a couple of academic partners. So we had one faculty member from the School of Social Work at the University of Toronto, and then myself, I was at the time was researching for LGBTQ health, which is a queer and trans health research team based out of the Center for Addiction and Mental Health in Toronto, as well as the University of Toronto School of Public Health. We also were provided with funding from Women's College Hospital, specifically the Women's Exchange 15K Challenge. And I think that this is also important to talk about because this is a really unique funding structure within the City of Toronto, and that they really are emphasizing the importance of community-based research. So you actually cannot apply as a principal investigator for this funding source unless you are at a community organization. So folks who are at academic institutions are unable to apply for this particular funding, which I think is a great way to prioritize community-based research. So this project started from a needs assessment conducted by Planned Parenthood in 2012. And this needs assessment was looking at the sexual health needs of youth overall. But through that assessment, they found that the trans youth that they spoke with were experiencing a high level of unmet need around sexual health and also lacking access to appropriate sexual health education and service provision. So appropriate meaning that education and service provision were inclusive of a wide range of bodies, of sexual desires and activities, and that we're not just focused on heterosexual, cisgender activities and sexual health education needs. So the overall goal of this project was to develop a set of guidelines that would enable sexual health educators and service providers to be more inclusive of trans and non-binary youth within their education and within their practice. And to accomplish that goal, we developed a set of guidelines that we'll show you some excerpts from and that are posted on Planned Parenthood's website. And these guidelines in particular were developed to prioritize the needs and wants of trans and non-binary youth and include a lot of direct quotes to amplify their voices. So as part of this project, our research coordinator and our advisory committee worked together to create a 3-minute video. So Pete, if you want to go ahead and play that, and then we'll jump back to our discussion.
At Planned Parenthood Toronto, we recognize that trans youth experience a high level of unmet need with regard to sexual health. So we came up with a small community-based research project which received funding from the Women's Exchange 15K Challenge with the goal of increasing the inclusion of trans youth in sexual health education by developing guidelines around sexual health that include diverse trans youth. The project activities included focus groups with trans youth and interviews and focus groups with service providers. The outcome is a guidelines document called Trans and Non-Binary Youth Inclusivity in Sexual Health, which we launched in April 2016.
Wonderful experience being a part of the Youth Advisory Committee, most especially working together with the rest of the team and brainstorming on the different ideas to develop a guideline towards trans inclusion in sexual health education.
Trans youth already face so many barriers to their health. And if they don't feel safe in seeking sexual health services, then it makes it even more difficult for them to have the health care they need.
I had quite a few experiences where I've gone into interact with healthcare providers or sex educators, and they've been very convinced that my gender doesn't exist.
So I think having a project that really speaks to trans people's needs and seeks to include trans people in their own medical care is really important.
My name is Kenan McKinnon, and I'm the research coordinator for the Developing Trans Inclusive Sexual Health Education Project with Planned Parenthood Toronto.
I think the next steps would be implementing these guidelines into sexual health care, because as trans people it's difficult to have to go into these settings and become educators. So I think that these guidelines should be mandatory for healthcare, especially in sexual health.
Okay, thank you. So that video gave us a little bit of an overview of the project, but I wanted to talk a little bit more in detail about the project design. So I'm going to talk about all of the different steps and how they relate to one another, but then we'll delve in more detail into the ones that have a specific community-based element to them. So the project was developed initially by our primary investigator, Cheryl Dobinson, who you saw at the start of that video. And so she built this structure, and then we all worked together as advisory committee members and other research partners to develop the details for each of these steps. So after Cheryl recruited our our research coordinator and our research coordinator recruited our advisory committee members. We worked to develop focus group guides and interview guides. And so we conducted a total of 3 focus groups in this first stage with trans and non-binary youth. There was one for trans-masculine youth, one for trans-feminine youth, and one for non-binary youth. And those focus groups were directed at asking people about their sexual health, education, and service provision experiences, including what was negative, what was positive, and really focusing on their suggestions for, ideally, what would an inclusive sexual health education or service provision experience look like. So in this way, trans and non-binary youth could really voice what they needed and what they wanted in relation to their sexual health. We also conducted 8 individual interviews with sexual health service providers and educators. And so we specifically sought sexual health professionals who indicated that they felt they were doing a somewhat decent job in terms of being inclusive in their education and health provision practices. So we really wanted to have conversations with these folks to see, what it was that they felt was going well for them, what they felt was still challenging, and in particular trying to figure out what they saw as potential personal or organizational barriers to be able to provide inclusive care and education. So each of these focus groups and individual interviews were audio recorded and then transcribed verbatim. And then the research coordinator and myself, we worked together to do the first go of data analysis of those transcripts. So we utilized a thematic analysis procedure. And based on that, we worked collaboratively to draft the first version of the guidelines, which then went to the advisory committee, gave a lot of feedback on those guidelines, and the guideline draft was revised based on that feedback. So we then had a town hall meeting to review those guidelines, which we'll talk about in a little bit more detail in a few minutes. And then after the town hall, we incorporated the feedback we got there into another revised draft of the guidelines document. After that, we had that revised document and we conducted another series of focus groups. So we conducted 2 focus groups with trans and non-binary youth again, and then 2 other focus groups with sexual health service providers and educators. So in each of these, everyone reviewed the then current draft of the guidelines and gave feedback on what they thought was helpful and useful, or things that were potentially problematic, or things that needed to change. So after those focus group sessions, we recorded and transcribed those sessions as well, continued with the data analysis, and used that data, the results of that data analysis, to then further revise the guidelines. At that point, we held a community launch event with a final feedback session. And again, we'll talk about that community launch event in more detail later. But after that event, we had the finalization of the guidelines, which you can find on Planned Parenthood's website, and we'll have a link to later in this presentation. So focusing on the project design elements that were more specifically rooted in community-based research principles. For one, Planned Parenthood hired a research coordinator to serve in a paid staff position at Planned Parenthood to help the creation and progression and facilitation of this research project. And so to ensure that this project adhered to trans community priorities and values, we hired a research coordinator that had deep knowledge and connection to trans community in Toronto. And so our research coordinator then recruited our advisory committee, which Evan will talk about in more detail, the tasks that the advisory committee helped and directed. I would like to share a few details about the town hall at this point. So you saw on the video an excerpt of the town hall that had a panel of our advisory advisory committee and research coordinator, and then we broke out into small working groups to really dig into the guidelines document. So this town hall happened about halfway through the duration of the project. So we had this really early draft of the guidelines, and really only the research partners and the advisory committee had seen it at this point and given feedback on it. So we held the town hall meeting at a place called the 519 in downtown Toronto, which is the community center for LGBTQ community in the Greater Toronto area. And at that town hall, we promoted it to community members, to trans and non-binary youth, and we solicited service providers, sexual health service providers, and educators to attend it as well, to have a wide range or representation from different stakeholder groups to come and give feedback on the current draft of the guidelines document. So the advisory committee helped facilitate the small group work sessions where people were able to give feedback on the guidelines in smaller groups that we took notes on and recorded. And at that town hall event, we also had large posters that represented different pages from the guidelines document that people could go and give written feedback on as well if they didn't want to give verbal feedback. And then the community launch happened towards the end of the project, so right before the finalization of the guidelines. Evan, would you like to give any description of the community launch?
Sure. So it was in some ways similar to the town hall, except it didn't have the breakout groups. So we started with the Youth Advisory Committee had a panel essentially, and we spoke a bit, and we also invited a Q&A with the audience. Again, we had the opportunity for feedback through verbal feedback. You could also provide written feedback on poster sheets as well, and we also had pieces of paper people could write down a question if they wanted someone else to read out the question. And we basically went through the final guidelines and discussed the process similar to as we're doing now and what these findings were. And it was really about providing the community with the opportunity to give us that final feedback and also to sort of celebrate the fact that we could come together and this was a project we could work on and that people so desperately needed.
Mm-hmm. Yeah, I think that's a really good description of the community launch and the purpose that it served. So again, after that process, we incorporated the feedback that we got at the event into the guidelines and revised them another time before finalizing them and posting them online. So as stated earlier, I'm going to go into a little bit more detail about the role of the research coordinator with the project, and then Evan will talk in more detail about the advisory committee. But again, in line with community-based research principles and ensuring that the progression of the research project was really rooted in trans experience and knowledge, our research coordinator first assisted and led the recruitment of our advisory committee members, which were fantastic, probably the best advisory committee I've ever worked with on a project, and facilitated several advisory committee meetings over the duration of the project. Our research coordinator also did the first draft of designing the focus group guide as well as the interview guides that were used with the trans and non-binary youth sessions as well as with the service provider and educator sessions. So really figuring out what are the best questions to ask, what are the most important questions to ask, what are really going to get to the priorities for trans and non-binary youth in terms of sexual health. The research coordinator also led the data analysis process in terms of analyzing the qualitative data we accrued over these various formats. And I think particularly because as a research team, we adopted a constructivist approach to data analysis, meaning that we really saw the analysis process as an interaction between us as researchers and the data and our participants. So really recognizing the validity of that knowledge and expertise of trans community and trans health, and seeing that as a very interactive process. Our research coordinator also led the event planning and coordination of the 2 different community events we spoke of. So Evan is going to now give us a little bit more detail about the advisory committee with the project.
Great, thank you. So as Corey mentioned, I was on the Youth Advisory Committee, and we were brought together to sort of provide feedback throughout the duration of this project. And I think having the Youth Advisory Committee was really significant because not only were we all between the ages of 16 and 29, we were also all trans or non-binary identified. So again, we were giving feedback, having experienced transphobia in healthcare and having that sort of first-hand knowledge. Now, one of the reasons we were selected was to provide feedback on each stage in a way that wasn't necessarily prescriptive. So we weren't coming up with the guidelines ourselves. It was really important to us that it was the youth that we interviewed and had focus groups with, that they came up with the guidelines, and that we were there really to work through each step of the process and make sure that there was proper representation. So one of the things we did was come up with our terms of reference. So we sort of outlined the vision and objectives and scope of the Youth Advisory Committee. So again, that's where we delineated that we were there to support the youth and the information they were providing without necessarily being the ones to prescribe what was to be included. We were there to make sure that the questions that were asked were ethical or worded in such a way that would encourage more responses, things like that. So we held meetings about once a month for the duration of the project. So we had about 8 meetings, and each meeting we had a different topic or part of the project we're focusing on. So in the initial stages, it was developing the questions for the focus groups and also brainstorming how we were going to reach out to the community. So coming up with different places to advertise for the focus groups, for instance, so trying to seek out trans and non-binary youth, so that included sexual health providers, but it also included universities and schools where we could, community centers, things like that. And then once the first focus group had been completed, then as Corey said, the information was sort of brought back to us, the data, and we went through it and tried to see, find sort of the patterns, what was a recurring theme, what needs to be addressed, but also trying to figure out perhaps what was missing. Was there a question that wasn't attended to? Was there something that we should have perhaps worded differently to try and get more clearer picture of what's going on? So again, with the participant recruitment, we all sort of participated in that using our networks and trying to reach out as best we can. And we also developed the community events. So the town hall questions, for instance, we came up with together. So we also discussed actually the format of the town hall, what we wanted to look at. And one of the things that was really important to us, for instance, was that these community events be accessible. So part of accessibility is the building physically accessible for someone who may have difficulty with mobility. So making sure there's a ramp, making sure it was on the first floor. So this was really important. Another thing that was important was having accessible washrooms and gender neutral washrooms, or open all gender washrooms. So at the 519, because it is primarily an LGBT community center, and for the Church Street area, they're all gender and gender neutral washrooms. So that was another way to ensure that sort of accessibility. We also had ASL interpretation. So we had someone signing American Sign Language throughout the presentation so we could make sure we could reach out to as many people as possible. One thing that was sort of flagged over and over again was our concern that trans youth with disabilities weren't being included enough, that their needs weren't necessarily being met because of the stigma of not only transphobia, but then also issues around disability and ableism. So that was another key component. And again, we provided feedback on each phase of analysis. So after the town hall, we reviewed that feedback, and that's what helped us to develop the questions for the second round of focus groups. And then again, after we went through the data collected from that, we revised the guidelines again. So it was basically a way of making sure you have feedback from the community. So we were really sort of the sounding board, the community sounding board, if you will, and sort of the reviewers in that sense. So I already addressed a few of these, but as I said, space and accessibility were very important to us. And with attendance, again, we wanted to reach out to as many people as possible. Again, particularly racialized communities that are underrepresented. A lot of work within the LGBT community does tend to focus on white members of the community. So it was really important to us that we try to get as many people as possible and reflect the diversity of the community, but also attend to those needs, because different community members have very different needs. So another important thing was recording this community feedback. So again, we decided to do a variety of different methods essentially for collecting this feedback. So some of that was Q&A at the town hall, opportunities for someone to sort of raise their hand and share that with us. We also had the flipboard so that people could write something down if they didn't feel comfortable sharing it publicly. We also had breakout groups, so then this allowed for small group participation. So again, those who maybe didn't feel comfortable sharing with the entire room could still share in a small group. And we had someone from the advisory committee attend each small group to take notes and take down any questions people had, and then those were addressed again. So those were some of the techniques we used for trying to address accessibility and also get as much feedback as we could and really encourage that. All right. So we'll review a few examples from the guidelines. So this page right now that says examples of inclusive language, that can be found in the guidelines. The link, I believe, has already been sent through. We'll send it again as well. So one of the things that was really important was trying to get away from really gendered binary language. So often everything comes down to male or female, boy or girl, masculine, feminine, things like that. So we were trying to think about other ways of discussing bodies. So, for instance, these examples of how on the right, those were some suggestions from the focus groups of different phrases that could be said. So, for instance, as I said at the beginning, trans is the more acceptable term that's preferred over something like transsexual. And trans is an umbrella term, and that really allows for a variety of identities. So by using that term, then you might not be placing a particular label on someone who doesn't identify that way. Another way to think about it, the example, for instance, of saying estrogen or testosterone, naming them rather than saying male or female sex hormones. That's a way of getting out of sort of the binary again. Now, down at the bottom, we have some examples of particular body parts. So, for instance, where it says chest as an example rather than breast for transmasculine people. So transmasculine people may not feel comfortable with the word breast because they identify either as male or as masculine, and so using the word chest can be really affirming. On the other hand, trans feminine persons may prefer the word breast because it is a feminizing term, a feminine term. So one of the things that we did struggle with when creating these guidelines was there were sometimes oppositional views or things that appeared to sort of contradict one another. So what we really decided was important was showcasing these different examples and then explaining that it's really about what the individual wants. So if you're ever unsure, it's okay to ask. So rather than making that the assumption, you can say, how do you prefer your upper torso to be referred to as? And someone may say chest or breast, for instance. Or how do you prefer your lower region to be referred to? Again, then if the person says a certain body part or just says genitals, for instance, then that's the appropriate language. So these really are just examples and ways to think about changing the way we talk, because we do often use terms without even necessarily realizing that we're sort of reinforcing these ideas. Okay, here we go, Corey.
Thanks. So this is the other slide we have that showcases an excerpt from the guidelines document. So language was a huge portion of it. It was really important both to the trans and non-binary participants as well as the service providers and health educators to get a better understanding of inclusive language and how to use it. Another important aspect was creating physical environments that felt inclusive to trans and non-binary youth who are students or who are clients for health service providers. So one of the ways that our participants said that people can do this is through trans-affirming posters and pamphlets, which you see up here. So our participants talked about how having trans-affirming posters or pamphlets around a classroom or a school or within a doctor's office can make people feel safe and included. They can also be informative for youth, or they can be used by youth to then inform other people in their lives. Our participants also talked about how these posters and pamphlets can be used to signify that they should expect a higher level of care or a higher level of education in that particular space, and that would be inclusive of their experiences. On the flip side, some participants also talked about how if they saw inclusive or affirming posters and pamphlets around and then didn't receive the level of care they expected based on that, that they could use the existence of those posters and pamphlets to sort of advocate for a higher standard of care for them with that particular educator, with that particular service provider. We also included this particular excerpt from the guidelines because the quote there comes from one of our participants, and so this really exemplifies how we really tried to use direct quotes for a large portion of the guidelines document so that service providers and educators were really being able to have access to trans and non-binary youth's own thoughts and their own words about these various issues. Okay, so other knowledge translation activities that we had in association with this project. So one, the online distribution of the guidelines. So that link there is where you can access the guidelines on Planned Parenthood's website if you're interested in reading them in more detail. Also conducting this webinar that you all are attending right now. And we're in the process of working with our advisory committee members and research partners on a variety of conference presentations as well as academic manuscripts. So again, just highlighting the community-based research principles and that we really want to be integrating our advisory committee and our research partners in a variety of knowledge translation activities, and not just focusing on dissemination within academic or medical spheres, but also thinking about documents and materials that are accessible and useful to a wider variety of community members. So I'm going to talk a little bit about the successes of the project, and then Evan will talk more about particular challenges that we came across. But one of the main successes of the project is that we really had significant input from trans and non-binary youth throughout the duration of the project in all of our different phases. So in large, that came from our advisory committee being, as Evan said, an amazing sounding board for the various stages of the project, but as well as focusing on including trans and non-binary youth in the focus groups and in the community events as well. So one great thing about having those community events is that we were able to have folks who weren't quite 16 years old still be able to participate and give feedback on the guidelines document in those contexts. We also had a substantial amount of community investment across different stakeholder groups. So we had the 519, the community center that we held our events at, that gave us free space to hold those events. We had a very good attendance at both of our community events. I think we had over 60 people at each one, with a large representation from both trans and non-binary youth, as well as health service providers and educators. Another success of the project is that we have this tangible final product that people can access online, and that it really prioritizes and highlights the voices of trans and non-binary youth. And then, as Evan mentioned, there were several steps taken to ensure accessibility of the project, and that was really championed by our advisory committee. So Evan's going to tell us a little bit about some of the challenges with the project.
Thank you. So some of the challenges was the fact that this was a community-engaged project versus a community-controlled research project. So, for instance, while trans non-binary youth were included, they weren't necessarily the official investigators of the project. So trans youth, in that sense, didn't dictate what the project was going to look like and what the final product would be. So that would be if it was more community controlled. However, because it was community engaged, that means there was that constant communication and working together. It's also difficult when dealing with youth, having issues around consent, for instance, around information and dealing with parents and things. So we do have to always be careful when dealing with youth, because there is the potential of that power imbalance to be magnified. Another limitation was because of is to increase our outreach to marginalized communities, particularly Indigenous and Two-Spirit people. Canada still has a very active settler colonial mentality in Canada, and the Indigenous communities continue to be marginalized. So it's very important that we engage with the Indigenous community and Two-Spirit people to make sure that their needs are also being met, and also other marginalized communities. Another consideration is how to deal with power dynamics across different identities. So, for instance, speaking with trans and non-binary youth who are also people of color or may have a disability or hearing impaired, these are various examples of ways that these power imbalances can actually be maybe magnified depending on who is conducting the research and who is being researched, because there is this history of often cis people studying trans subjects or white researchers studying communities of color. So this is very important to always keep in mind, is that these power dynamics are always present. And the other challenge was negotiating and allowing for differing views within the report. So as I mentioned earlier, for instance, transmasculine identified people may prefer the use of the term chest, for instance, when talking about the upper torso, whereas transfeminine people said they prefer the term breast. So in this sense, we couldn't come up with a definitive single term to use across all trans identities. So we did try to specify who might be more inclined to prefer that term, but it was important to include both, because the trans community is diverse, and these aren't static identities, and the needs of the community change based on the person. So it's important that we don't create a monolithic trans narrative or a simple 5 steps to how to treat trans people, because it is always going to be individual needs that need to be met. Great. So in conclusion, our findings really stress that the needs of trans and non-binary youth are best understood by trans and non-binary youth. And that was really the whole focus of the project. And that's why, again, we had the Youth Advisory Committee and we had the focus groups with trans youth, because only trans youth can tell us what they need, how they're being treated, what their service looks like. We can't sort of prescribe this for them. We've seen these kinds of programs try and teach youth, and they don't work when they're not driven by the youth's needs. So by engaging with the youth to find out what their needs are, we're better able to address them. And this slide here, these are the references from the studies, particularly the case studies that we cited throughout the PowerPoint. Those will be available as well with the rest of the presentation. And now we'll open it up to questions.
Great. Hi, this is Pete, back again, your technical host. Thank you so much, Evan and Corey, for such a great presentation. I put on the screen contact information for your presenters if you want to get more information. And we do have time, maybe 5 or 10 minutes for questions. So I think the best way to handle it is to, if you're interested in making a comment or question, type something into the chat panel and indicate that. And then I can unmute you one person at a time. I wanted to share, there is also already a comment on the chat panel from Al, who says, thanks, especially for the guidelines. I will encourage their use in local efforts to integrate primary, physical, and behavioral health care delivery. Good work.
Thank you. Thank you.
And also, there was a link that's in, you're going to be getting a copy of the slides, so you can check all the information on the references page and other material. But here, let me put on the chat panel again a link to the guidelines that were discussed earlier. And we'd love to have some comments or questions. You just type something. You could type a question or comment in the chat panel as well, and send it to either me, the host, Society for Community Research and Action, or to everyone. Okay, there's a question on the chat panel from Noe. Thanks for your presentation. What has been your biggest challenge?
Evan, is there anything you want to say about that, or would you like me to take that, or?
You go ahead first.
Okay. So I think a couple of challenges that came out from this particular project. One, as Evan expressed earlier, the difficulty in ensuring we could represent a variety of perspectives in terms of what people wanted to be in the guidelines. But I think that also applied to the sexual health educators and service providers as well. So we found it really challenging to create a guidelines document that was useful both in an educational and a service provision context, because there's some things that teachers said, if that I could see this working in a one-on-one session, but there's no way that I could implement this within a classroom setting, and vice versa. So I think sort of narrowing what the guidelines would actually be able to do and be useful for was one challenge. And I think another challenge, just from my perspective as a researcher at an academic institution, is just keeping constant vigilance in terms of power dynamics and potential hierarchies that might be perpetuated through projects like this. Just being sort of constantly aware of the possibility for that to happen, and taking every step that I can as a researcher to try to prevent that. And so that's just something that I'm always trying to think about and keep in mind, particularly as we engage in the dissemination process around writing manuscripts and doing conference presentations and things like that. Evan, did you have anything else to add?
Yeah, just another thing is that's difficult is to know how it's being implemented and if it's being implemented, and sort of following up in the sense that, again, we could, someone may say they're going to take this on and share it with all the doctors in their clinic, let's say, but are the individual doctors reading through the document, are they willing to participate and take that on? So knowing if it's actually being used or implemented in that way, and knowing how, is really key, I think, and something that we don't know yet. And another difficulty is, as with many of these things, is funding and being able to have a wide distribution. So we don't have the budget, for instance, to be creating hard copy bound sort of pamphlets that are mailed out across the country, or to any service providers who ask. We are able to provide free copy online, though, and that's an advantage for sure, because then anyone can access it. So that's sort of a trade-off there. But really, I'd say dissemination and implementation are the biggest challenges.
Thanks. There's two more questions on the chat panel, and one is, I think, on the theme you're talking about. Jessica's wondering, can you tell us about the process of sharing these guidelines with providers and what the response was? Were they receptive?
Yeah. So I can speak to that, and Evan, if you have anything to add, feel free to. So we had, I think, really good investment from educators and service providers who were already feeling like they were committed to the idea of providing inclusive care and education. So we had really good response to service providers and educators who wanted to partake in the community events, as well as in the interviews and focus groups, which I think was really great. In terms of the particular representatives that I personally was in contact with, so thinking about Planned Parenthood as a community health center, we also had representatives from various sexual health clinics across Toronto, and we did receive a pretty warm reception in terms of what they thought of the guidelines. A few people did talk about how they thought challenges that they perceived as a possibility with some of their colleagues, but people were very committed to still sharing them with all of their colleagues, even if they expected some type of pushback. A couple of the recommendations that we had from the service providers and educators to have these guidelines be taken up more positively, or by a wider range of educators and providers, was one, having a training webinar that people could get continuing education credits for. People saw that as an incentive, or doing a mandated training session within a teacher within schools. So there's a couple of avenues that would be great to take, and if any of you plan to take these guidelines there, we would love for those things to happen.
Follow-up question from Jessica. Are the guidelines available in other languages?
That's a great question. We had one potential community connection to translate them into French, I don't know if Planned Parenthood has started that process or not. I can check in, and you're welcome to email me to follow up, and I can give you an update on that. That was certainly a desire from a lot of the community members that showed up at the different events. It was an ask that we got a lot. One of the potential issues with that, as Evan brought up, the challenge of funding, and so that we had $15,000 to do the project overall, and the budget for this particular project did not include translation and back translation of the guidelines document. So if we're able to find other funding for that process, then that's certainly something we would be interested in doing.
And just one final question on the chat panel from Rebecca a little bit earlier. She's just wondering, in reaching out to your networks for participants, did you use any sort of social media, and if so, how?
Yeah, Evan, would you like to speak to that?
Sure, I'll start anyway. We did use some social media. I'm not sure if there was a particular sort of Facebook set up for it. I don't believe so, but we did share, for instance, the call for participants on social media and within our network. So we were sent essentially JPEG posters that we could then post on our social media, asking and inviting trans youth and service providers to our focus group. So we did use social media in that regard, and also for in preparation for all the community events as well. Do you know, Corey, if there was another social media component?
I think the only other components were beyond individual social media accounts, that we also had access to Planned Parenthood and the Researching for LGBTQ Health team social media accounts as well. So both of those research groups promoted the chance to participate, as well as the community events on Twitter and Facebook.
Well, thank you very much. So just a final comment from another person, just a comment from Rachel. She says, this is really great. Thank you so much for sharing your incredible work. She looks forward to being in touch in the future. So I think that kind of wraps up our webinar. Did you want to make any final comments?
No, thank you all for attending.
Yeah, thank you. It was wonderful.
Okay, great. Thank you, and thank you, Evan and Corey. On behalf of the Society for Community Research and Action, we thank everybody for participating, and we hope to see you at a future online event. Thank you.